Actually, Dr. Jong Hyun-woo has worked as a doctor overseas, so there was naturally a gap while he was away from Korea. Because of that, the amount of available data from Korea is quite limited. But patients don't really know about these things, to be honest. Even when the staff explains it, they still don't quite understand. So I felt a bit regretful about that. I really wanted to mention that one of the key reasons I have high respect for Dr. Jong Hyun-woo and really wanted him to join our hospital was because Dr. Jong Hyun-woo has had extensive experience treating VIP patients in the Middle East. Especially, he had extensive experience with lifting and eye surgeries. If you're looking for top-tier lifting or VIP surgical care in Korea, of course, as a representative, I highly recommend Dr. Jong Hyun-woo. He takes his patients very seriously. And since surgical results aren't always completely satisfactory, even in those situations where things don't turn out as expected, he puts a lot of effort into finding solutions. And I've heard that he really puts a lot of effort into it. Seeing that side of him, I thought to myself that I absolutely had to bring him to our hospital at least once. I really hope patients are able to see and understand this. And I also hope that patients will come to our hospital and get first-hand experience. If by any chance what I said turns out to be different from your experience, please feel free to let me know honestly, and I believe we can learn from that and continue to improve.
Shall we start with introduction? Dr. Bae In-ho, please.
Hello, I'm Dr. Bae In-ho from AB Plastic Surgery.
Yes, hello, I'm Dr. Jong Hyun-woo from AB Plastic Surgery. Perform eye surgeries and anti-aging procedures and lifting surgeries.
I've heard that you've also been very active overseas. Could you briefly introduce that for us?
I previously provided medical care in Qatar at the Korea Medical Center in Qatar. I was the head of the plastic surgery, dermatology and wellness center there. After about 2.5 years there, I have now returned to Korea. I'm curious about what kinds of cases are most common. Anti-aging surgeries are the primary focus. There were also quite a few patients coming in for lifting procedures. Surprisingly, there were also quite a few eye surgeries, as well as abdominal and arm lifts. There were a fair number of those kinds of surgeries too. When we think about it in a general way, it seems like there would be a lot of wealthy people, right? Was that true? Everyone there is a VIP patient.
Then personally, I have a question. Did you have any difficulties communicating?
Basically, only 10% are actual local citizens, and English is common. Not everyone speaks it fluently, even with basic words. We can have full conversations with just that, you know?
Words and body language?
Just words are enough. If it's hot, you can just say AC on, and we can still communicate. So we don't need to say complicated conversations, and I was able to communicate just fine. If there was something a bit difficult during surgery, I would call in an interpreter, and we would have conversations together through the interpreter.
From what I've heard, for Dr. Bae In-ho, what inspired you to decide to bring Dr. Jong Hyun-woo into plastic surgery?
Well, you might not really know this, but back when I was a university student, as far as I can clearly remember, Dr. Jong Hyun-woo was actually, I think he was an intern who had just passed at that time. He was about to step in for surgery, and it was like he was heading into hell, washing his hands and getting everything ready. At that time, I was really envious. So I asked Dr. Jong Hyun-woo back then how I could get into plastic surgery major. He told me that if I worked hard, of course I could make it.
Probably said something like, just work insanely hard. I think that's what he told me.
Seeing him walk into the operating room like that, I had a really good feeling about it. And I often thought to myself that I really wanted to become like that too.
Actually, I had heard a lot about Dr. Bae. Dr. Bae was already famous even as a student. He was known for being really good at having fun, and for being really clever and having a great sense. So when I heard, oh, he applied to plastic surgery major, and then we also did a reference check, you know, when we looked into what kind of person he was and things like that, he had a really good reputation.
Thank you very much.
Feel when you hear things like this?
It feels good, of course. But now, honestly, it's like the relationship between a boss and an employee. Actually, when I made up my mind to come to AB Plastic Surgery, I looked back on my past. I wondered, did I ever give Director Bae a hard time in the past? I thought, okay, I think it's fine for me to join.
Actually, ever since Dr. Jong Hyun-woo was in the Middle East, I really wanted to bring him here. We kept asking, and that's how he ended up coming to our hospital. Actually, the main reason I'm filming things like this together is because Dr. Jong Hyun-woo spent so many years in the Middle East. So the materials left in Korea are almost like relics.
Plastic surgery also famous in a place like Doha?
Actually, K-beauty isn't just famous in Doha. It's well known throughout the entire surrounding region as well. At this point, it's kind of a trend. I think it's a global phenomenon, a worldwide trend.
In Doha, what patients did you work with? Was anti-aging?
Yes, I mainly focused on anti-aging treatments. Body contouring surgery is something you can't avoid doing if you're in the Middle East. Surgeries like liposuction are actually extremely common procedures there. I did quite a lot of those as well.
If you had to pick one field you're confident in,
Just one?
just only one?
Or two.
I really enjoy doing eye surgery, and I also really like performing lifting surgeries.
What do you think is the most important aspect of lifting procedures?
I think it's being natural. Lifting is something you do to return to your younger days. If a lifting procedure is so obvious that people can tell you had it done, I honestly don't think that's good plastic surgery. So when it looks like you haven't had surgery but you look much younger, when people say you look about 10 years younger, I think that's what makes a good lifting procedure.
Dr. Jong Yeon Woo, you also need to do contour surgery. I wonder if I made any mistakes during my residency. Let me think again. When I look at a lot of doctors who perform facelifts, I understand that scars are actually proportional to the amount of care put into them. To make the scars look better, is there anything in particular you pay special attention to?
Actually, this is a bit of a technical issue, but you have to perform this mass surgery well. In my opinion, it all depends on how much skin you remove and how nicely you design the scar. Just because you cut away a lot of skin doesn't mean the lifting will be successful. You really need to pull the S-mass in the right direction first, and then remove the excess skin generously. Scars don't seem to be very noticeable. Also, because of issues like blood circulation, there's much less risk of skin necrosis or skin deterioration. So, I believe that the most important thing in lifting surgery is the S-mass work.
What kind of experience do you actually consider the most important?
Honestly, the most important thing is, since I already experienced working with Dr. Jong Yeon Woo during my residency, I actually didn't realize it before, but as the clinic grew larger, and as I met more doctors, I really came to appreciate the training I received during my residency and how important it was. Back then, while seeing our reconstruction patients, I would look at their wounds and manage them. At the time, it was honestly really tough, but compared to other university hospitals, we actually received an excessive amount of training. It was a hospital known for giving too much training, but looking back now, those experiences turned out to be incredibly helpful. And since I already knew Dr. Jong Yeon Woo well back then, because I was already familiar with him, I had no doubt about his skills in that regard. If you ask around about the hospitals he worked at, you can find out everything. And when I did, everyone who had worked with him had nothing but great things to say about him. So we kept persuading him, and that's how things moved forward.
Senior, please come, just come over.
But I wasn't close enough to ask him like that.
When I was about to join, Director An contacted me. He said, let's have a meal together when you come to Korea. Director An and I actually entered university together as classmates.
I really begged Director An a lot. I asked him to put in a good word for me.
Do you ever chat privately on KAKAOTALK or Telegram, or are you both too busy?
These days we don't use KAKAOTALK.
We don't do that now.
What sorts of things do you usually talk about generally?
How we're going to perform the surgeries, especially with Dr. Jong Yeon Woo. I tend to discuss cases about overseas patients or those who need particularly good results. So I talk a lot with him about those kinds of patients. I think we talk about those things a lot.
At least I hope we can be known as the hospital with the best results in Seoul, in Korea. I want us to continue to build a reputation as a hospital that can maintain that level of excellence. So I think we need to do more diverse research and keep thinking about how we can achieve even better results. That's something I'm really focused on and thinking about a lot these days.
Is there anything else you'd like to say? Dr. Bae In-ho, please.
Dr. Jong Yeon Woo has so much experience and is a doctor who really knows what he's doing. So I have no doubt he'll do an excellent job. I think I should support Dr. Jong Yeon Woo so he can continue to practice his medical skills at the hospital. I think I should help him.
Doctor, is there anything you need on the second floor? In the doctor's office?
The second floor is really great. It's absolutely wonderful.
This winter and in the future, with all the patients we'll see, I hope we can take good care of them together.